Okay, so today I'm going to be doing hip palpations on Lauren. So we're going to start off with skeletal anatomy. So first we're going to find the iliac crest. So that's going to be right over here. We're going to follow that all the way down to the anterior superior iliac spine. And then if you go down a little bit further, you can find her anterior inferior iliac spine. And then we can also find the iliac fossa, which is going to be right in here. Obviously there's muscles covering it, but it's in there. And then I'm going to have you turn. And then we're going to find the posterior superior iliac spine. So we can follow the iliac crest all the way down into here, and sometimes there'll be like dimples on the spine, but Lauren doesn't have that, so it makes it harder for me. Anyway, so right in here. Okay, and then I'm gonna have you turn. So next we're gonna move on to the ischium. Actually, I just realized I have to just sideways. Yeah. So I'm gonna have you lift your leg up, like flex it. Okay, and then you can find your ischium right in here. Flex your knee. Like lift it. Okay. So that's gonna be right in here. Actually, you can probably turn around more. Yeah. So do the same thing. There you go. Right in there. Okay, and then we also have, okay, turn around. We also have the pubis. I'm just going to point to it. So yeah, next we can move on to the femur. So I'm just going to have you scoot a little bit closer to and turn sideways. Move your arm. Okay, so we can find the greater trochanter, which is going to be right in here. And then the lesser trochanter is going to be posterior medial. So I'm going to have you turn a little bit. So we're going to work posterior, and it'll be medial over here. Okay. And then I'm going to have you stay facing the back. And on the back, we can also find the pectineal line. So this is going to be, again, posterior medial. And it's going to be near the lesser trochanter. So that's going to be right over here. And the gluteal line is in this area as well. And we also have the intertrochanteric crest, which is posterior, and then turn. No, all the way front, yeah. And then we can find the greater tuberosity here, and you're gonna find the intertrochanteric line in between the two anteriorly. Okay, and then next we can move on to the joints. So we have the coxofemoral joint. So this is just your hip joint. It has 3 degrees of freedom, so we can do hip flexion, extension. So flexion, extension, and then you can put your foot down. And then so we have AB and adduction. So abduction, just move your leg out. Okay, I bring it back in, and her bringing it in is the adduction. And we also have internal and external rotation. So I'm just going to ask you to turn your foot in. Yep. And then you can turn it out. Yep. So it's 3 degrees of freedom, and it is a ball and socket joint. And then if you turn, we also have the fully, yeah. So then we also have the sacroiliac joint. Okay. In the back, so that's going to be on the left and right. And so if we find the posterior superior iliac spine, you're going to go down and in, and there's going to be a shelf. So it's going to be right around here. Okay, you can turn. Yeah, all the way around. So next I'm going to move on to soft tissues. So first we have the iliotibial band. So I'm going to have you turn. And that runs from the iliac crest all the way down to Gertie subracle. And then we also have the trochanteric bursa, which is going to be right over here on the greater trochanter. Well, yeah, where is it? Right here. It's right over here on the greater trochanter. And then we also have the iliopsoas bursa, which is going to be right on the anterior inferior iliac spine. So again, we're going to find the anterior superior and move in over here, and that's where that's going to be. And then there's also the ischial bursa. So that's going to turn here, and I'm going to have you flex your, knee flexion as well. And that's going to be right on the ischial tuberosity. Okay. So we also have the sciatic nerve. So what I'm going to have you do is turn here. And if we go like this, the sciatic nerve is going to run in there. Okay, so we also have, I'm trying to think. Yeah, I believe that's it for soft tissue. So we're going to move on to muscles now. So I'm going to have you face forward again. So we're going to start off with the sartorius. So the sartorius originates at the anterior superior iliac spine, and it inserts at the pes anserine, which is going to be right down here. And that does flexion, abduction, external rotation of the hip. So next we can move on to rectus femoris. So that's going to originate at the anterior inferior iliac spine. I'm going to move in here. And it's going to insert at the tibial tuberosity, which is going to be down here. And it does hip flexion. So, yeah. You don't need to flex your knee too. You're good. Okay, so then next we're going to move on to the psoas major. And so that's going to originate, turn at T12 through L5. And it's going to insert at the lesser trochanter of the femur, which is going to be in here. And that is going to do hip flexion. And then also the iliacus originates at the iliac fossa. So I'm going to have you face forward. Okay, so it originates right in here. And it inserts again at the lesser trochanter of the femur, which is going to be posterior over here. And it also does hip flexion. Next, I'm going to do the tensor fascia lata. Tensor fascia lata. And so that's going to originate at the outer lip of the iliac crest. And it's going to insert at the greater trochanter of the femur. So it's going to be turning right over here. And it does hip flexion, abduction, so abduction, so nope, that's extension. Just, yeah, no, it's okay. Just come, bring your leg out. Oh. Okay, there you go. Okay. And then it's going to do internal rotation. So that's just, yeah, you turn your leg. No, yeah, there you go. So next I'm going to do the bicep femoris. So I'm going to have you turn around. And this has two heads. So the first head originates at the ischial tuberosity. So again, if she were to put her hip into flexion and her knee into flexion, you could feel it in here. And if you followed it down, it also goes into the linea aspera of the femur. I think I forgot to mention that at the beginning, but this is where it is right in here. So those are its two origins. And it inserts at the head of the fibula. So I'm going to have you face forward. So the head of the fibula and I believe it's the lateral tibial condyle. So head of the fibula, which is going to be right in here, and then the lateral tibial condyle. So next I'm going to do your glutes. So I'm going to have you turn around. Yep. Okay, so we're going to start off with gluteus maximus. So this is going to originate at your sacrum, your coccyx, and the iliac crest. It's going to be, yeah. So sacrum, coccyx, iliac crest, and it's going to insert at the iliotibial band and the gluteal line. So again, that's going to be right over here, and then the iliotibial band right over here. And this is going to be your primary extensor. So, yeah. Next, we're going to do gluteus medius. So that's going to originate between the iliac crest and the anterior posterior gluteal lines of the ilium. So we have the iliac crest, which is right here, and then the anterior anterior posterior iliac. Okay, so that's going to be right on the back over here. So anterior is the top one, inferior is the middle. Okay, so it's going to be here. So we have iliac crest, anterior, and inferior gluteal lines. Okay, and then the gluteus medius is going to be an adductor. So, okay. So next we're going to do the gluteus minimus, and the gluteus minimus originates at the anterior inferior gluteal lines of the ilium. So again, that's going to be right over here and right over here, and it inserts at the greater trochanter over here, and it also does abduction. So next we can move on to the adductors. So we have adductor longus. So yeah. No, just like turn around. Oh. So we have the three adductors, adductor longus, magnus, and brevis, and they all originate at the pubic bone. However, the adductor magnus also originates at the ischial tuberosity, which is going to be, again, turn. Yep, right over here. Okay, you can turn around again. So the adductor longus inserts at the middle 1/3 of linea aspera. So I'm going to have you turn. So middle 1/3, so linea aspera runs from about here to here. So we have the middle 1/3 for adductor longus. Adductor brevis is the proximal 1/3, so that's going to be shorter one, and then adductor magnus is going to be the distal 1/3 of linea aspera. Okay, and all of these do hip adduction. So I'm going to have you turn around again. And then the last two, so we're going to move on to the piriformis. So the piriformis is a primary external rotator. So that's going to originate, if you turn around, at the sacrum. And it's going to insert at the greater trochanter of the femur. And this is going to do hip adduction as well as a little bit of hip flexion. So,
you want me to hip flex?
No, you're all set. And then there's also the pectineus, which originates at the pubic bone as well. So I'm going to have you turn around, and then it inserts at the pectineal line of the femur. So that's going to be over here as well. And that is going to do hip flexion. And then I'm going to have you turn just to the side. And then the last one that we're going to do is gracilis. So that originates at the pubic bone. And then the pezanserine. There we go. Yeah. Okay. So then that also inserts at the pezanserine, and it does hip adduction. Okay. It's okay. And that's it.